Okay, let's go ahead and grab your seats, please, so we can go ahead and get started and try to be on time today. That was more for myself than you, just so you know. The sound is what? Is it my voice or is it just the overall sound? It needs to be louder. Can someone in IT make this a little bit louder, please? I can't see anything. Okay, so I'll just keep talking while they're increasing the volume, the intensity of the sound. So thank you so much for supporting the American Cochlear Implant Alliance and helping us continue our success for individuals who have cochlear implants through research, awareness, and advocacy. What I'd really like to do is start by thanking those who have really contributed to our organization, and that's with our board of directors. So we have a group of 14 on our board with 4 on the executive committee, and we're really thankful for all of their contributions to help move the field forward, in addition to everyone of our members as well. So if we can have everyone on the board, please stand up so we can give you a round of applause for all of your work on the committee, including the ones on the stage, please. So I want you to know this is a group of interdisciplinary professionals. We have surgeons, we have audiologists, speech-language pathologists, and we also have a parent member. So, and a lot of advocacy goes on, but this is a really great way to get involved in the organization. And what I love about this is not only do we get to connect, but we do get to connect on a deeper level, and it kind of becomes like a little family. So I feel really strongly that these are amazing people. If you see them in the hallway, please thank them. I also want to recognize, not quite, the staff. And so the staff of the American Cochlear Implant Alliance, which is Donna Sorkin, we have Laura Odato, Nicole Weston, and I don't know where the slide is. Do we not have a picture? And Jessica Houck. So thank you so much for their work, because they do a lot to keep us organized and help to get everything set for the conference. A couple other things that I want to recognize. Sorry, can we give a round of applause for our staff too? Sorry about that. We couldn't get a lot of things done without them to keep us organized and on task sometimes too. We do have some committees that I just want to recognize that we have these committees. It's a great way to get involved in the organization. So we do have the Board of Director nominations, which Camille Dunn has headed up for the last couple of years. We have the Research Committee that Michael Ho has headed for us. And then there are several conference-related committees. I know we talked about the Scientific Program Committee that Jake Hunter and Viral Tajani led this year. And we have had lots of other contributors to abstract review, session moderators, so thank you to everyone contributing to that. There's also the Continuing Education Committee. We have the Student Scholarship Committee and the Student Poster Competition Judging. So if we can just give a round of applause to everyone who served on those committees as well. And I think that's all I have to say for the moment. I'm going to introduce Camille, and she's going to tell you a little bit about the process for the nominations and what we have in store for you coming up. So thank you so much for coming, and here comes Camille.
All right, good morning. So I want to recognize the Board Nomination Committee, Dr. Dave Kelsall, Dr. Brittany Sprouse, Dr. Zombeck, and Dr. Hall. Can you please give us a round of applause? We sought 4 individuals to join the board. 2 were surgeons, 2 were audiologists. We had 22 wonderful applications, and so it was a hard decision-making process. We wanted to involve everybody, but of course, we're limited by having the 2 surgeons and 2 audiologists. We would like to do a member vote on these 4 candidates: Dr. Kinley, Dr. Charles Lim, Dr. Allison Beaver, and Dr. Michael Scott. Can we do a member vote for Kinley? Who says? Okay. Dr. Lim? Dr. Beaver? And Dr. Scott? Can you guys please stand? All right. We will also do a vote to continue our beloved Andrea, Dr. Warner Sis, to continue as the chair of the board. Okay. Thank you. And then I want to recognize 3 terms that have been served by these 4. We will be rolling off at the end of this meeting. So please stand. I'll get on this board now. All right. Thank you.
This is a picture of the Alliance staff that I was looking for before. So we already showed our appreciation for them, but I just want you to know they do an amazing job, and we really appreciate all that they do. Here is the entire planning team, so you can see not just from the ACI Alliance staff, I can't see anymore, but also the meeting planning team, and they've done a lot to help get everything organized, make sure that the sound works, and if they need to make adjustments that they do, that captioning is working. So thank you so much for the meeting planning team who's worked very closely with the Alliance staff to make this conference happen. And now what I'm going to do, I'm going to turn this over to Donna Sorkin, and she's going to update us on different activities and the key activities that are going on in the organization. So Donna, come on up.
Thanks very much, everybody. And just to add to the comments that Andrea made about our amazing team, we have 4 staff that are full-time, but we have this extraordinary core of people that work with us on the conference and on other activities, on our website, our financial planning, et cetera. So that's why we're such a mighty team. We have this 4 core people, and then lots of specialists that work with us all through the year on the meeting and on everything else. So I meant to go back. These are the 5 priorities that we are working on for 2024. And just to give you a little sense of what we think is really important for us right now, the first one is a continuation of the listening language literacy messaging that we introduced last year on this stage. And since that time, we've really had a lot of pickup for that. It was intentionally done, so it wasn't just ours. It's a community resource. And then we want to be working more on research related to societal benefits. I'm going to tell you a little more about that. Awareness on cochlear implants in older adults beyond the hearing health community, where we've got a lot of pickup on the results of the NCD last year. And lastly, the collaborative advocacy that we're doing to advance parent choice and to support the EDI programs. So this was what we introduced last year, and the last time you saw it on a stage, it had our logo on it, and we took that off so that other groups would pick it up and use it. And it has become an important resource for a lot of different organizations, just to really, in a research-based way, emphasize the relationship between listening and literacy. And our keynote speaker in a little while will also be talking about these same issues and topics. And then one of our members, Alejandra Alere, took the initiative in putting together a group of Spanish-speaking audiologists and clinicians and translated this same document into Spanish. So it's being used across our United States and Latin America as well. So we thank them for that. And then we push this forward also in terms of really emphasizing the role of parents in promoting language for their children at home, in the language of the home. And what we have found is this is actually being picked up in the larger community for children who don't necessarily have hearing loss. So we're joining that track now of people who are really emphasizing the benefits of families in fostering the language of the home with their children. And then this second item was on research on societal benefits. If you've been in this field as long as I have, you remember when John Naparco first came out with this cost-utility analysis of the cochlear implant in children that was published in JAMA in 2000. And we used this work extensively when we talked to federal officials and others about the societal benefits. But the work was getting old. And so we as a board really wanted to advance this to a greater degree and have updated work on this same topic. And so we awarded a grant to Advocacy, who put together an interdisciplinary team to look at educational outcomes, quality of life, and cost effectiveness. And that work that she and others did really updated in an important way that earlier work that John Naparco and others did. And there were two important publications that have come out in JAMA in 2023, looking specifically at educational outcomes and societal benefits and quality of life, and one more recently in 2024 that looked specifically at cost effectiveness. So this is really important information, but we haven't gotten it out to the larger world. So that is an important priority for us this year. Any of you that have ideas who want to be involved in that, Yvette is here at the meeting. Talk to any of us about how you might like to be involved. And the third item is the awareness of CI benefits in older adults. We really focused on this a great deal last year within the hearing health community. Had a lot of articles and presentations, and it really helped. I understand from clinics and from the CI companies as well that the numbers of older adults seeking cochlear implants as a result of the NCD and the work that we did to publicize this has really gone up. And some of these have been in publications with very wide distributions like Forbes Health, which has, several million subscribers. What we want to do going forward is also add in Wikipedia and elsewhere and to highlight cochlear implants in veterans organizations. And then SSD, the Medicare coverage, and under 5 is an initiative that's underway. And Dr. Casati is going to tell you more about that in just a minute. And then lastly, our work on collaborative advocacy on parent choice. This year, if you read what we have been putting out on this topic, you might realize we're pretty concerned about some of the information that families might be getting in the future from the early intervention system. Because on March 28th, the federal government took an award that had been taken care of for 24 years by Utah State and awarded it to Gallaudet University. Some of the language that we have seen in the abstract for Gallaudet's work is quite concerning. It's emphasizing what they call a language first framework, which is code for ASL. So they're really going to focus on that aspect of it, we feel. And we're very concerned about ensuring that the across perspective that that program has had since Utah State has had responsibility for it won't be lost. So we have expressed our concern about it, and we have met several times with HRSA, the agency in charge. And we're going to partner with others on this. So we are collaborating with organizations in the field, and we'll be working with them to communicate with HRSA and to look at what's going on at the state level, because that's really where it happens, and collect data directly on state EDI activities together with them. And then within the ACI Alliance, we met this Wednesday with about 50 of our state champions, and we're encouraging them to get involved at the state level, to become involved in their advisory committees at the state level, and to help us collect data. And we'll be doing that under the direction of the research committee of the board of directors, helping to give us a system for doing that. If you want to get involved, get in touch with me or with Nicole Weston and become a state champ and help us push this forward. These are the partners that we're working with on parent choice. So we have 10 partners. We recently increased by 2, and here at the meeting, a couple of members told me that they would like their organizations to be involved as well. So the next time you see this slide, we'll probably be up 2 or 3. So it's a strong coalition of groups, all of whom are interested in ensuring parent choice. And these are some of the barriers that we will be looking at. This is derived from a number of studies that have been done over the past 5 or 8 years on the major barriers to early intervention via providers, patients, and family members. This content, I won't take you through it now, but it's on our website as well if you want to follow up and see what we have there. So I'm going to stop. It's time for Dr. Casati to tell you a bit about the SSD work.
Good morning, everyone. My name is Mara Cassetti. I'm a neurologist at New York Eye Neuro in Mount Sinai in New York. I'm going to make this very quickly. We all at this meeting have had some great discussions so far on cochlear implantation and single-sided deafness, and we know there's a lot of evidence for that. I'll be focusing primarily on adults, and it's no surprise to anyone in this room that Medicare beneficiaries with single-sided deafness are not eligible for cochlear implants. So the ACIA board has responded to that with a plan to initiate a national coverage determination request using existing real-life data. So as you may expect, that's very hard to find because of the catch-22 that, in fact, those individuals are not getting implanted by the very fact that Medicare does not cover that. So we have enlisted a large group of centers across the country where we are planning and are in the process of gathering that real-life data and using that to submit to CMS. They have indicated a willingness to accept real-life data for review in terms of their policy change, and that is our plan for the upcoming NCD. These are the currently participating institutions, and I'm very thrilled to have the opportunity to improve the disparity that our Medicare beneficiaries are currently experiencing with respect to this technology. Thank you.
So I am not Lisa Park, although I wish I were as smart as her. So thank you. I guess let me find my slides then. Whoop. So I just have to start one small piece of unrelated housekeeping. At dinner last night, I learned that during the Stump the Experts panel, one of my statements might have been misunderstood. We did not implant the kid with no auditory nerve. I would not recommend implanting a child with single-sided deafness and no auditory nerve. Sorry for anybody who misunderstood that. I'm aggressive, but not that aggressive. So I just want to say what a wonderful meeting this has been so far. We as a board, through the liaison committee, have really tried to optimize the process by which meeting content, poster content, speaker content has been chosen. And I think you can see the fruits of those labors here. So I just want to give this large group of people on this slide a big round of applause for all the hard work that they've put in. We will be specifically recognizing our two conference chairs, Viral and Jacob, in 1 second, but they are listed there. I also want to say a very warm congratulations to our chairs for next year's conference, Dr. Carrie Colio from Rady Children's and Esther Vivas from Emory University. I'm not going to go through the list here, but you can see everybody that's been involved. So please, if you find them in the hallways, reach out and shake their hand and give them a hug and tell them what a nice job they've done. It is also time to say goodbye to some of our program committee members. You can see the list here. Without your hard, tireless work, again, all of these past meetings that have been the successes that they have been would not have been possible. So again, not going to read the names, but you can see them there. Please, again, congratulate them and thank them for all of their hard work when you see them. And just a nice round of applause again for this group. Out with the old, in with the new. These are our new conference program committee members. Lisa Golden from NYU, Doug Sladen, sorry there's an extra D there, Doug, but from here locally, Molly Smeal from Cleveland Clinic, Kevin Zahn from Northwestern University, Michael Harris from MCAL, as it is affectionately known. I will ask that you not give them applause, but instead tell them how sorry you are about all the hard work that they have in store for them, but we are really excited to have them join. And last but not least, if I could have Viral and Jake, I see you both on opposite sides here, so if you could come on up. It goes without saying that this meeting, planning this meeting is similar to herding cats. You have a bunch of surgeons and audiologists and SLPs and therapists and educators and psychologists that you have to get on a call once a month from all different time zones, now including Canada for this year. So it is not an easy job. These guys have done absolutely spectacular, and I think they deserve one more big round of applause. And for their hard work, we have some office swag that you can hang. So, Jake, thank you again for all of your hard work. And Viral, thank you again. Your baby's gorgeous.
Thank you. Thanks, Steve.
You would come up to the stage now, the panel members. So what we're going to do at this next stage is explore a little bit further the issues of the early intervention changes that we're seeing in our country. And we have asked people from different perspectives who are involved at different points in the early intervention system to join us and have some discussion about what they're seeing and what all of us might do to address the changes. So I'm going to start with Carl White. Carl is the director of the National Center for Hearing Assessment and Management at Utah State. And Dr. White is the individual who has been really the key person in early intervention in this country for at least 25 years. So, Carl, my question to you is, what changes have occurred recently in EDI, and what is your take on what this means for the future? And you can just talk about it from your perspective or broadly.
Thank you, Donna. I'm delighted to be here, and it's so exciting to be in a meeting that has so many people who have contributed to the progress we've seen over the last 25 years. And I think one of the most important things we need to do is to remember where we've come from. And if you go back 30 years ago, before we had universal newborn hearing screening, then the average age of identification was 2.5 to 3 years of age. The best tool we had to identify children were the JCIH risk factors, followed by auditory brainstem response, but that only affected about 5% of all children. And what a lot of people forget in that is that half the children who have hearing loss, congenital hearing loss, don't have a risk factor, and 98% of the children who had a risk factor didn't have hearing loss. And so it really was a hit and miss process. That all began to change in the mid-1990s when the federal government awarded money to states to establish universal newborn hearing screening programs. And that's worked very well for the last 25 years. The focus has been on screening children before 1 month of age, getting them a diagnostic evaluation before 3 months of age, and referring them to an early intervention program before 6 months of age. And as Donna said, we've been serving as that National Technical Resource Center for many years, and I think there's been a lot of progress made, but most of that progress has happened because of what people like you have been involved in, what's happened at the state level. The success of early hearing detection and intervention programs really is a local concern. As Tip O'Neill famously said many years ago about politics, he said, all politics is local. And I think all successful early hearing detection and intervention programs is local in the final analysis, even though it benefits tremendously from work like the ACI has done and other large national organizations. It all comes back to what happens locally for it to be successful. I share Donna's concern. I'm worried about what's going to happen at the federal level. I don't think we should prejudge that. I think we should give the process an opportunity to work, but we need to remain diligent to make sure that those who now have responsibility and funding to support early hearing detection and intervention programs really are supporting programs that provide services to all children, and that all children are able to benefit regardless of what their families' choices are about communication modality. One of the things that concerns me the most, that I think that everyone in this room can contribute to, is that we know very little about what the work plan is for the new Implementation and Change Center or the new national network for EDI. The work plans for those organizations that are located at Gallaudet, the American Academy of Pediatrics, and the Hands and Voices organization haven't been revealed, even though the funding period is now 4 months old. We know almost nothing about what those groups are going to be doing. And I think we need to hold our federal representatives accountable for sharing with us what those groups are doing and how successful they are. And then we need to get involved in supporting the good things that are happening. I am worried about what's happening at that national level. I'm not as worried about what's happening at the local level. one of the things that I think is very important to recognize is that we have 59 states and jurisdictions that have well-established, successful early hearing detection and intervention programs. And those programs are going to continue to exist and do good things because of passionate, competent, committed people. But they all need our help in doing that. And so even though there are changes happening and we don't know exactly how that's going to affect children and their families, I think we have a good foundation that's been built over the last 30 years that we can continue to build on and continue to do good things. Thanks.
Thank you, Carl. As you can see, we have reason to be concerned. So let's hear next from Linda Hazard. Linda is an audiologist, has been involved in cochlear implantation as well, and she is the director of the Vermont Early Intervention Program and also the director of the Part C program in Vermont. Linda, what challenges do you see for EDI coordinators around the country?
Thank you so much, Donna, and thank you for the question and also this wonderful opportunity to speak to this group. I'm really enjoying the conference and all of the opportunities, and thank you for all that you do. So first, I just wanted to mention that EDI programs under the HRSA funding, grant funding, there are 59, so that includes all jurisdictions as well as all states. There's a secondary funding as well, which is the CDC, and that funds special projects, and currently we are, there are 39 states, I should say 38 states and 1 territory funded at this point in time, just to kind of give you a little history. I will say that EDI programs on April 1st began our new 5-year grant cycle, and we were still reeling from the changes and from the unexpected changes, I'll say, on March 28th. Our EDI programs are moving forward. We are in a planning year currently, and as well as the national network is also in a planning year for the first year. So what are some of the challenges that we encounter? I think you all probably know that we encounter challenges every year for the past 26 years of EDI funding. But some of those challenges right now are the new national network because we are not aware of how they will be supporting us, what will be happening. It's still in the planning stages, and as Carl mentioned, we have not seen the work plans for any of the 3 network centers. In addition to that, there have been expanded expectations of EDI over the years. So we started really with 136. We were also involved with and are involved with family support, family leaders, parent leaders, and now we are expanding into areas that are almost beyond our scope of practice in the majority of states, which includes having baseline data by year 5 of this grant for language assessments and developmental assessment information. And that can be challenging for a number of our states because Part C and non-Part C, we need to figure out data sharing agreements. We need to be able to work with those Part C and non-Part C providers to provide that information. We also need to identify what assessments we should be using, and that could differ state to state, which also presents challenges. In the last HRSA funding, there were 22 states, of which Vermont was one of them, that was awarded supplemental funding to begin to look at these language assessments. And CDC had a special project with the University of Colorado called Odyssey, and that is a project that we've been working with since 2021 to look at language assessments for children who are deaf, hard of hearing, and deafblind in Vermont. So there's a starting point with those 22 states, but there are so many challenges with figuring out data sharing and how to move forward. And then how do we compare the data from state to state, given that we may be using very different assessments. So another area of expansion has been identifying children with acquired and progressive hearing loss. And we were, in this current grant cycle, or previous grant cycle, asked to come up with a plan for doing that. And that's very challenging also because it's really outside our scope, but yet at the same time, we want to be able to provide information and identify those young children with progressive and acquired hearing loss. So again, it requires partnerships and collaborations with other stakeholders in order to achieve that. The number of federal reports that our EDI coordinators write, thank you. A number of the EDI a number of reports that we're writing, funding, those are other areas. And again, just a quick comment, there are about a quarter to a third of EDI coordinators who leave each year. So we have new coordinators coming in. And I'm going to end here because I know we're running out of a little bit of time. Thank you.
Thank you very much. Let's move on. Linda, that's really helpful. It's not often that we have an early intervention coordinator here on a panel at ACI Alliance, so we really appreciate that. Our next speaker is Nicole Weston of our staff. Nicole is our governmental affairs director, and she is really in charge of our state champions program. So Nicole, tell us, what are our state champions doing to improve opportunities, and what did we determine as our key initiative going forward for state champions?
Sure, thank you so much, Donna. For a very brief background, our state champion programs, we have 187 state champions in 45 states, and we're always looking to expand that because they do work on a wide range of issues, including early intervention. One of the things that we talked about at our Wednesday meeting, and we've also talked about in the past, is having our champions make fruitful connections with the EDI coordinators and the EDI programs in their states. And this could look as simple as maybe presenting at some of the EDI webinars and meetings that they do on kind of what the background is on your particular issue or your clinical practice. Or joining the EDI Advisory Committee that helps set guidelines and works with the EDI coordinators moving forward. Every single state does have an EDI Advisory Committee, and we will be working with them to help make those connections, which we think could be beneficial just across the board for all children. We've also talked about kind of engagement in the broader medical community about these issues, the discussions of language nutrition and things along those lines. And then also reporting back to us and others on the sharing of real-life, real-time insights on the impact of any changes that are happening within the EDI programs within their states. Often we hear, because I get a call from a state champion or an email saying, this is what I'm seeing a couple years down the road, and we're able to use that information moving forward. And as Donna mentioned earlier, there will be the research committee who will be doing some insight on data, and the champions are going to be critical to that because they will help us sort of set up the initial framework of how things will work and will help report back into that information. And of course, they're also there to support any and all positive outcomes and changes that are happening. And I think one other point to mention is that in the most recent EDI reauthorization in 2022, there was Congress asked for a GAO report on what is happening within the EDI programs when it comes to provided information and also services in rural communities. We understand that that GAO report is currently being written, and once we have that, we'll be able to disseminate that to the general public, and our state champions can use the findings in that to help move particular issues forward and help respond to concerns that are in there. If you're interested in joining this for this issue or any others, please let me know. I'm over at the resource table. Thank you.
Thank you, Nicole. Our next and last speaker is Dr. Nancy Young from Lurie Children's Hospital in Chicago. Nancy, how have you as a surgeon been involved in your state to address the legislative proposals that could hamper what you try to do with families?
Yeah, thank you, Donna. I'll tell you right now that the take-home points are, I think it's very important that physician leadership be involved in when these type of legislative initiatives that are concerning arise. Denise Thomas, who's the lead audiologist in our implant team, she's sharp as a tack. She really understands what's going on. But in order to take advantage of what our medical center has to offer us in this way, I think it's very important that the physician leadership be involved and that we work as a team. And we've been very successful that way. And when I mean getting the medical center involved is every major medical center has to have a government affairs department. And these are people who understand the legislative process in your state. They likely have lobbyists who really know what's going on, kind of boots on the ground. And they know the quirks of the individual legislators and what's important to them. And that's been really essential to our success in our state. After Lead K came out, local organizations that really well-serve children in our area approached us and alerted us and said, this is a great thing. We read it. We were very concerned that this severely would limit parent choice. And so, yes, we worked with the ACI Alliance, but equally important, we involved our government affairs, and I said, this is what I'm being told about this by local organizations. Should I be concerned? And they said, what you're being told is incorrect. You have every right to be concerned. They had tucked legislation hidden into an unrelated type of educational bill. And basically what I was told is this is like just the foot in the door, okay? So that things are only gonna progress from here. And we were, they enabled us to arrange for a meeting with the legislator. We got the other organizations like ASHA and the Board of Ed that were concerned about aspects of this legislation to show up. And it was just a discussion, and it was very clear that this legislator just really didn't understand the issues and was surprised that this legislation was at all controversial, and it really went away. Then more recently, another piece of legislation came up once again, would it severely impact parent choice? And it came up at the end of a legislative session. I went to my government affairs people. They were like, okay, we have a couple of months until the next session. I mean, I didn't know these things. We can now communicate with this legislator. We wrote to them. We had Donna and her team help us with what to say. And once again, the legislator was surprised that this was not something everyone was embracing. And now this is at least on pause for now, but more to come. So I'd like to thank Donna and her team. They really made a big difference, but there's no way medical centers are going to pay adequate attention if we don't have the physician working in concert with the audiologists.
Thanks very much, all of you from the panel. You can see we need a very diverse team to make this work. So thank you very much, and join us, everybody.
So thank you for talking to us about the past, the present, and the future of the organization and EDI legislation, and hopefully what we can do to work toward that. But speaking of the future, I know you thought Lisa was going to talk earlier, and that was just like, to get you so excited about what she's going to say, but she's actually going to talk to us about the future with the student poster competition.
Thanks, Andrea. We had a wonderful group of professionals who previewed the submissions this year and selected students to interview at the poster session yesterday and to choose our winners. We had a great group of top-notch submissions this year, so it was not an easy job. So I'd like to recognize these folks for their time and expertise and for supporting future providers and researchers. We can give them a round of applause. So without further ado, I'd like to announce our runners-up and our winners. We have 3 different categories, so I'll go through each group and then we will acknowledge them all at the end. So in our surgical medical category, our runner-up is Adriana Barrios on exploring decision regret and quality of life in adult cochlear implant recipients with single-sided deafness. And our winner is Jordan Varghese, looking at tonotopic-based intracochlear electrocochleography estimates. In audiology, our runner-up is Andrina McDonald, who looked at intraoperative ESRT. And our winner is Robel Alemu, who looked at spatial hearing accuracy in children with cochlear implants and peers with bilateral bone conduction devices. And in rehab, our runner-up is Ansley Kunath, looked at evaluating effects of audiovisual training on speech understanding. And our winner is Sofia Machado, who looked at exploring the impact of home language exposure on Spanish outcomes of deaf and hard of hearing bilingual children. So if we could give all of them a round of applause and congratulations.